Nashville, good afternoon. I'm Andrea Fanta. Four city officials are here to discuss Metro's latest COVID response. You'll hear from Mayor John Cooper and Dr. Alex Jahangir, chair of Metro's coronavirus task force. You'll also hear from Dr. Gil Wright, who directs Nashville's public health department, and Chief Swan, who leads Metro's Office of Emergency Management. We will take questions. Let me now introduce Nashville's mayor, Mr. John Cooper.
Good afternoon. Thank you for joining us. Nashville, like other cities, is experiencing a COVID surge, and today is an opportunity to address what Metro is doing to respond. In just a moment, Dr. Alex Jahangir will review our latest case and hospitalization numbers, and Dr. Wright will talk about citywide vaccination efforts, and Chief Swan will discuss how Nashville is increasing our vaccination and testing capacity. Cases here are rising quickly, and we know the Omicron variant spreads easily, even more easily than previous variants. But what's different today, and the reason for today's call, is the booster. If you are fully vaccinated and have received a booster and you then contract COVID, you will very likely experience illness that is much less severe. The vaccine and the all-important booster gives us a way to manage this surge and move forward with our lives. Now in Nashville, 62.9% of Nashvillians are fully vaccinated. That's 0.5% higher than the national rate. It's also more than 11% higher than the state's vaccination rate. But just fewer than 168,000 residents have received the booster. And now that number needs to go way up in the coming weeks. Nashville, today is your day to get your booster shot. Now, we're committed to making it as easy as possible to get your vaccine and booster and a test if you need one. And I want to thank the entire Metro team for increasing their efforts to match the current needs, despite staffing constraints. Now, we've increased the number of testing lanes and we've expanded to Saturday testing, and Metro Public Health has increased its community vaccination and testing events. Now, none of us want to be talking about COVID still, but we have the tools we need to manage Omicron. The booster, the vaccine, and testing when needed, and masks. So remember to get your booster shot and to wear your mask when appropriate in public. And let me turn it over now to Dr. Alex Jahangir.
Thank you, Mayor Cooper. And I'm sorry I can't be with you all this morning, or this afternoon, excuse me. Here we are again, and here's the latest on the coronavirus in Davidson County. Now, the number of active cases we currently have in our county is 22,776 people. 1 out of every 30 Nashvillians currently is actively infected with COVID-19. Just last week, this number was a little less than 16,000. And to put this in perspective, when we were at our worst days with the Delta variant, we had 8,500. And we're now nearly 3 times that number. Total number of cases in Nashville from the beginning of this pandemic sit at 167,346. And unfortunately, 1,368 Nashvillians have died from the beginning of this pandemic. Now, one thing about these numbers report is most likely underreported, as many people who have tested positive may have done so at home using an at-home kit, and these numbers are not necessarily reported to us. The 7-day average of new daily cases is 1,970 cases per day, and the average 7-day average for cases per 100,000 is 284. And again, to put this in perspective, at our worst days in Delta, the number of cases per 100,000 was 96, and now we sit at 284. And the 7-day positivity rate is at 36%. That means for every 3 tests that are conducted, 1 turns positive. And as Mayor Cooper mentioned, our vaccination rate in Nashville for fully vaccinated individuals is 63%, in line with the national average and over 10 points higher than the state average. And while 436,491 Nashvillians are fully vaccinated, and not all of them currently qualify for a booster, only 49% of the fully vaccinated have received a booster. So to reiterate the mayor's message, it is so important that if you qualify for a booster, to please get one. We also to see our hospitalization rates go higher than it has in the recent past. Today, there are 707 patients in Nashville area hospitals with COVID-19. About 23% of these individuals, or 165, are in the ICU. About 90 days ago, the most we saw for a single day was 457, of which 36%, or 163 people, were in the ICU. So the percentage of people in the ICU currently is less than we've seen historically. Now, we have been talking regularly with the leaders of our hospitals, and these leaders are once again doing everything they can, including again canceling non-emergent surgeries to ensure that they can take care of the critically ill patients, both COVID and non-COVID, that present to one of the medical centers in our region. One of the biggest challenges for our area hospitals is staffing. Now, you may have seen the latest report that you may have seen last week that New York City reported that of the COVID positive patients admitted in New York City hospitals, 49% of the patients were admitted for COVID, and the remainder, or 51%, were admitted for other reasons and incidentally tested positive for COVID. Now, while we don't have that exact breakdown for all of the COVID positive patients admitted in our area hospitals, I suspect that our breakdown in Nashville and probably Tennessee could be somewhere similar to New York. But the thing to remember is this: even though this variant may cause a smaller percentage of infected people to be hospitalized because of the virus, there are a lot more actively infected people than ever before. Thus, a smaller percentage of a really large number is still a lot of people filling up our hospitals. Also, let's not lose sight of those admitted and seriously ill from COVID. These people, by several multiples, are mainly unvaccinated. Vaccines save lives, so go get your vaccine and your booster if indicated. And remember, as we have for nearly 2 years, we must continue to approach this with a sense of community. So please do what is needed to take care of each other now. Thank you, Dr. Wright.
Thank you, Alex. Thank you, Alex. Good afternoon. Studies from multiple countries indicate that proportionately, fewer people are becoming seriously ill with the Omicron variant. It is likely due to a combination of previous immunity through infection and vaccination among large numbers of the global population, and that Omicron does not affect the lower respiratory system as much as prior variants have. But Omicron is highly infectious. Here in Nashville and across the state and country, reported daily infections have increased to their highest point throughout the whole pandemic, with up to 40% of those tested being positive as of January 7th. For protection from the Omicron variant, we recommend everyone get vaccinated. If you're among those 62.9% of our residents that are fully vaccinated, then we thank you. You are making a difference. If you are part of that large percent of individuals eligible for a booster, please get your booster as soon as possible. Getting your booster almost doubles your protection from Omicron. You can get a vaccination at a large number of places throughout Davidson County. These include the community assessment centers, Metro Public Health Department's mobile pop-ups, pharmacies, urgent cares, and providers' offices. If you feel sick, are positive, or have been exposed, then please stay home to avoid spreading the virus to your coworkers. On the Tennessee Department of Health website, you can find a quarantine and isolation calculator to determine how long you need to stay home to avoid spreading the virus to others. Common symptoms of the Omicron variant are similar to other viral symptoms, like you would see in a cold or the flu. These include a runny nose, congestion, cough, fever, and muscle aches. If you have any of these symptoms, please stay home, get tested, do not return to work until the test results are back and are negative. You can use over-the-counter medications to treat your symptoms. Please call your healthcare provider if you have questions, aren't getting better after 5 to 7 days, start getting worse, and especially with high fever or shortness of breath. Testing is widely accessible throughout Davidson County and includes Metro's 2 community assessment centers, Metro Public Health's mobile pop-ups, pharmacies, urgent cares, and providers' offices. You can also buy home testing kits in a number of retail locations, locally and online. Mitigation strategies are even more important now with Omicron due to its more infectious state. Please wear masks, preferably surgical or N95. Stay socially distanced. Continue to wash your hands frequently. Finally, get vaccinated or boosted if you haven't. And stay home and test if you feel ill. Please remember, for the latest updates on the pandemic in Nashville, including access to the calendar featuring our pop-up locations in the community, go to asafenashville.org and follow the health department on Twitter, Facebook, and Instagram. Now I'd like to turn it over to Chief Swan. Thank you.
Thank you, Dr. Wright. Good afternoon, Nashville. We have had a busy several days with the winter weather and all of its impact it had on our communities. The good news is that once again, we all came together to help navigate this situation. So thank you to all our partners. So OEM and Metro Social Services opened an emergency overflow shelter so that everyone who needed a place to stay had a place to go out of the code. I want to thank the Salvation Army in particular, because when our overflow shelters reached capacity, the Salvation Army opened a shelter that took in 100 people. That's truly an example of the Salvation Army dedication to our community and our partnership with them. We opened the emergency overflow shelter Sunday night, and we'll be opening it again tonight. We want to thank the social services, all of our community partners, both private and Metro partners, and especially the Sheriff Department and Metro Parks for providing safety at our sites. Everything you do to keep our most vulnerable population safe and protected. Metro Social Services Director Renee Pratt is tirelessly advocate for this community, so we want to thank her. One of the things that has been consistent about COVID-19 is our management of the COVID-19 testing and vaccination sites. Meharry Medical College continues to be a committed partner with Metro government. For 94 weeks, almost 2 years, Meharry has managed Metro's COVID-19 testing and vaccination centers. We remind the public that our hours of operation may change due to the weather conditions. Please stay tuned to our Metro social media platforms and the local news reports for updates on COVID-19 testing and vaccination events. The volume of our sites have increased greatly following the holidays and the spread of Omicron variant of COVID-19. On average, our sites test around 1,600 people a day. We also average about 90 vaccines a day. We are working diligently with Meharry Medical and Metro Public Health to make sure there is access to testing and vaccinations. Thank you to Metro Public Health for their continuing effort to provide access through their pop-up events around the community. You can find out about these events on the Metro COVID-19 informational website. To help with the surge of Omicron, both Meharry Medical College and the Metro Public Health Department will be working together to have a pop-up testing and vaccination on Saturdays at the 28th Avenue site through the month of January. That's the Charlotte location. Also, it's important to take note that around 30% of the people we are servicing at our sites are not Davidson County residents. We are not only serving the local community, but also people from surrounding areas. We remind the public that our drive-through testing and vaccination centers are just two of many options you can go to your primary physician, walk-in clinics, retail pharmacies like Walgreens, CVX, and also Walmart. Just like Nashville, the Nashville Fire Department is also dealing with surges in COVID cases. Because of the way we do our staffing, the impact on our department is not the same as it is on others. Currently, we have 121 of our employees who are off work due to COVID. That includes positive cases and employees who are close contacted with someone with COVID-19, like a family member or friend. We are actively providing vaccines and boosters to all of our employees who wants them. Our personnel continue to wear all of their personal protective equipment. Also, we are doing everything we can do to still make sure that we're able to provide Class A service. We're still able to make fires, medical calls, hazards, or any other things that require for first responders. So thank you to everyone who continues to fight this virus in our community. Please wear a mask, get vaccinated, and let's do what we have to protect each other. Thank you.
Let's take a few questions. First up is Blake Farmer with Nashville Public Radio. Blake, we're listening.
Yes, I actually have a non-COVID question. It's about the Overflow Shelter. Chief Swan, you talked about maybe the Overflow Shelter being at capacity the other night, and then I guess the Salvation Army had to step in. Can you talk more about when that was and kind of what you all were seeing?
Yes, thank you. So basically, our emergency overflow shelter got to a capacity where the staff ratio versus the clients were uneven. And for safety precautions and to make sure that we're not only being safe for the clients itself, but also the employees that work there, we reached out to the Salvation Army, who was very readily available to help us to take on that overflow of about 100 personnel, and it sort of thinned down the people that we had at our emergency shelter in order for us to be more efficient and more effective, because it deals with not only staffing for security and safety, but also to make sure that they're getting all the care that they needed. So it's just a great partnership that we've had with our Salvation Army.
Let's move now to...
Follow up, though.
Go ahead, Blake.
Are you saying, okay, thanks, Andrea. Are you saying that it was more that you just didn't have enough staff to manage the people you had, not that Overflow Shelter was, simply out of space or something?
Yes, Blake, it was just a combination of, again, the influx of people coming into the shelter and not having adequate staffing to manage that properly.
Thank you, Blake. Let's move to the next question. Next up is Maggie from Fox 17. Maggie, we're listening.
Hi there. This question is for Mayor Cooper. As we see these COVID levels that we're seeing right now, do you have concerns over what this means for Metro teachers? There are more than 260 confirmed cases among staff members throughout Metro schools right now.
Oh, yeah. Thank you, Maggie. And I'm sure MMPS will be happy to provide a more exact update. It is a concern that we are able to staff the city government. The 250 out of almost 10,000 employees at the school system would appear to be manageable. There are also concerns. Metro Police has 58 out of 1,900 employees. NDOT has 10 out of 294 employees. So it's a consideration to be staffed and successful going forward, but it applies to all of us, including our employees. Get the booster. And getting the booster will materially make you'll be less likely to get it, and then not bad symptoms, or hopefully not, statistically not very bad symptoms when you get it. So that's our message for today is, we have the tools to deal with Omicron. Use them. And that's going to apply to Metro staff members as well as citizens.
With no other questions in the queue, we're going to wrap up today's call. On behalf of the team here at City Hall, we want to thank you for your interest and, as always, your reporting. Please get your booster shot, get your vaccination, get tested if you need to, wear your mask, be careful, stay safe.
This has been a service of the Metro Nashville Network, If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.